especially excited because right before I took the panel, I went into a new role, which is Vice President of Innovation for SEP Health. So very excited to be alongside these two esteemed individuals in innovation. So our topic today is patient impact and the bottom line with digital health. I am your moderator, Bryan Arkwright, as I mentioned, Vice President of Innovation for SEP Health. We're a large physician staffing company. I'm also Chief Research Officer of Conv2x Health, which is a research and advisory group that collaborates with digital health organizations, and then also adjunct faculty with Wake Forest University School of Law, where I teach a telehealth overview course. So very excited to have these gentlemen here. I'm going to first let Paul Sterling introduce himself.
Yeah, absolutely. So thank you for having me. Pleasure to be here. I'm Paul Sterling. I'm the Vice President of Emerging Products at United Healthcare. I've been with United Healthcare a total of about 14 years. My role is really focused on the convergence of innovation in the healthcare space, just broadly defined, right? So that's in care delivery, that's in administration, it's in everything in between, and traditional health benefit products, right? So that's what we do at United Healthcare. And so my focus is on how can we improve these benefit products, these benefit designs with emerging solutions coming from, primarily my focus is outside the four walls of our enterprise. So taking cutting edge innovation, combining with what you would consider traditional benefit design, and delivering a product and or a service that moves the needle forward for our members as well as our enterprise.
And I'm Craig Lipset. Up until this summer, I ran innovation in medicine development at Pfizer down in New York. And so the scope there was very much around our portfolio of investigational medicines across therapeutic areas, across phases of development. And how do we bring in innovative new approaches to engaging patients, to leveraging digital tools that can help us to measure the efficacy and safety of new medicines faster and more efficiently. Today, I'm mostly working as an advisor with a number of venture and startup and tech that are all leaned in around medicine development, clinical trials, how to still achieve many of those same goals and objectives.
Excellent. Well, let's kind of start off. We collaborated on different questions that we feel would be valuable. First up, this is a telehealth track. Reimbursement for telehealth is quite the kind of patchwork quilt across the country in terms of state and federal requirements. How does, specifically at your organizations and the work that you're doing with innovation, how does reimbursement for telehealth and digital health factor into your innovation work or pilots?
Yeah, so I think in a number of ways. So I think the first thing I'll tell you is that you think about, from at least where I've sit in my experience, United Healthcare was, and this will not be a commercial for United Healthcare, trust me, but we think about kind of pushing the boundary forward in terms of digital health and telehealth. United Healthcare was a groundbreaker in that regard, 10 plus years ago in terms of commercial reimbursement for telehealth services. So I use that as an example to say, to illustrate the point that we're always looking for better ways to deliver care to those who need it, period. And we're very aggressive about that. Digital health, telehealth, new applications of telehealth beyond simple primary care. So we're always looking for and pushing the boundary in that regard. And reimbursement's a big deal, obviously, in that respect. And our medical policy tends to be very upfront and very aggressive to support that. The other side of that, I'd say, you think about, we think a lot about efficacy and safety in terms of telehealth services. So, first and foremost, there's a lot of good innovation in telehealth. There's a lot of good innovation in digital health. You can do a lot of things, but at the end of the day, you got to ensure that you are truly advancing and furthering somebody's health in terms of safety, and that the solution really has a demonstrated output, something based in research and evidence that this is there's efficacy in the solution itself. So you kind of combine those two things with a mindset of kind of moving the boundary forward, produces a good scenario.
So my lens is a little different. So I think I sit among the many different use cases that leverage tools like telemedicine in adjacent areas. And what's nice there is we can represent incremental revenue for companies as they're figuring out their reimbursement strategies. Now, I'll share what I mean by that. I put together at Pfizer the first fully virtual remote clinical trial for an investigational new medicine under an FDA's IND. And so we were leveraging telemedicine and other tools in the context of our interventional clinical trials in our medicine development portfolio. So reimbursement was less of an issue for us because we're the ones paying for it. We are the payer, we're the sponsor of a given research study. Now, to a venture that's supporting telemedicine, that is nowhere near as interesting revenue as it would be when their solutions get full reimbursement and they have, a solution either for a particular market or even, in a multi-state level. But as companies are growing, I think this represents an important channel for them to be able to get more incremental near-term revenue while they're figuring out their longer-term reimbursement.
Good stuff. And two very different lenses, but great answers. Thank you. Do you both have kind of your own business model for innovation? And if yes, could you elaborate on it?
So I would often get asked even, what are you defining as innovation, right? We all have ideas in a big company like Pfizer. If you have 100,000 employees, you've got, I hope, at least 100,000 ideas out there. And so the definition that I would subscribe to is an idea from which we derive value. Now, I worked in a cost center, right? R&D is not a revenue generating part of the business. We're a cost to the business. And so we don't often think about that innovation that we're using to support our medicine development efforts as where the value is revenue. Our budget is a fixed cost, and we want to try and get as much done under that as possible. And so by using a definition of an idea and you want to derive value from it, what that value is that you're looking to achieve is going to vary. And for where I sat, that value didn't mean how much revenue would it bring into the business. In most cases, it meant how did it either remove risk, accelerate, or otherwise impact the quality or cost of the medicine development efforts that we would have underway. And certainly as we would look at platforms like telemedicine, for us, that might mean how can we recruit patients faster by accessing, by improving access for patients from more diverse geographies? How can we reduce attrition in our studies and reduce the need to have to repopulate studies with more patients because patients are able to stay and participate in studies because of burden being reduced and access barriers being limited?
So, from United Health Group's perspective, what's unique about United Health Group is we touch pretty much every facet of healthcare, period. And so when you talk about business models for innovation in digital health and telehealth, I wouldn't say it's an easy thing to respond to, but I would say that you think about care delivery, you think about administration of benefits, you think about operations and administrations behind, you think about payment cycle and revenue. We touch every different area of the healthcare space, and so there's not one business model that drives innovation within our enterprise, because we're fortunate, frankly, to have, if we find an innovation that will drive a business model of one of our customers, that may be a small practice, it may be a hospital system, a large integrated delivery network, and across the board. So we're fortunate in the fact that we can look for innovation, we can develop, we can find innovation, and then match it to somebody on the other side within our book of business, within our customer set. So we're not restricted or encumbered by, this is our business model and this is interesting, but it doesn't fit, it won't take out costs, it won't drive revenue. We can really find the innovation first and then find a spot where it fits and then bring that out to the market.
Excellent. Kind of match it. And some good takeaways from Craig as well. Which leads into kind of the next question. Craig described it as a fixed cost at times. Are you profitable within innovation, and kind of how is that measured? Craig can maybe talk about former Pfizer and your future current endeavors, and very interested in both kind of your takes on that one.
Trying to measure the return on investment or return on innovation is a challenge, I think, in a lot of large organizations. My father was an accountant, used to say, figures don't lie, but liars can figure. And it's always easy to come up with some slide deck that justifies just about whatever idea people can come up with. There's probably some business model people can cook up around that. I think what we struggle with is the commitment to drive scale and adoption to realize whatever that return is. And by that what I mean is it's one thing to come up and say, here's my forecast, we're going to save X dollars, we're going to accelerate this by Y. But inside of an R&D organization, the only way you're going to get that return is if you get beyond a pilot, get beyond an experiment, and actually use whatever that innovative new approach is at a meaningful scale inside of your organization. And that requires change. These are much less sexy things than going after blockchain or telehealth or some awesome shiny new object. This is just old school change management, communications, really boring stuff that loses the attention of a lot of leaders. But without it, you don't get any of that return that you're aspiring to. You'll never get the ability to generate those metrics that you've really changed something and shown that return. And I think that lack of commitment to adopting is a pervasive challenge in a lot of big companies, and quite honestly stymies a lot of the growth for entrepreneurs and many of the types of startups I work with today. It certainly favors large incumbent service providers that aren't very interested in change and new approaches. And so I find myself today working with a lot of large pharma companies that are all stuck in this cycle of pilots and experiments and can't seem to figure out how they get themselves past it and be able to drive their innovative experiments to scale, and in doing so actually get that return on investment that they sold their board on so many months or years ago.
So I think, so you talk about engagement, from where I sit in our perspective, it's almost, maybe it's a little bit counterintuitive. You think a big enterprise, well-structured, you got to prove out the value on the sexy PowerPoint. It's counterintuitive a little bit because it's almost easier inside our enterprise. We know that engagement, it's kind of three areas, right? So there's engagement. If you can get people, you can get members' attention and sustain that attention, there's going to be value at the end of that road, near term and long term, period. So we don't have a lot of, we don't go through a lot of, just say rigor is not the right word, but it's not a barrier up front to define in very hard, ROI terms, what's the value of this initiative. If you can prove that you're going to get and sustain engagement in whatever solution it is, telehealth, digital health, our enterprise knows and believes that there's value at the end of that tunnel. There's the second dimension, clinical, and they kind of follow each other in order, right? So engagement, sustained engagement is number one critical. Clinical outcomes, efficacy, and safety, as I mentioned before. We know there's value. There's certainly value for everybody in that dimension. And the financials follow that. The hard, kind of traditional healthcare financials will follow that, right? And we believe in extending access, taking cost out of the system, right? How can you take cost out of the system? The tools and the solutions are there. You got to get people you have to present those in a way that's engaging, that's motivating, that's compelling, not for 6 months, not for 12 months, but for the rest of somebody's life in a lot of scenarios, right? So if you can get and maintain that engagement, the clinicals are going to follow and the financials will follow as well. And we believe that as an enterprise.
Excellent insights. Go ahead.
Brian, I was thinking about, when we were getting mic'd up, we were talking about kids, and I was thinking about how when we're putting together pilots or initial experiments inside of large organizations, there's a huge amount of effort and so much blocking and tackling that internal champions and leaders have to do so that those entrepreneurs in your organization that want to try something new can actually get that pilot done. And I often think that, it's almost like when our spouses are pregnant and you're going through this 9-month period and this journey and there's all this hard work and it's painful, but you know that at the end of that 9 months, the really hard work all actually begins, right? Like,
if it's your first, you don't know that.
Right.
Yeah.
But at the very least, hopefully you're reading a book,
Right, yeah, yeah.
And maybe you're baby proofing at home and you're thinking about, my finances and other things. And when we're doing these pilots, we're so focused on all the pain and the hard work that's going on that we have very little energy left to think about the baby proofing and what we're going to do when that pilot delivers. And at the end of those 9 months, to then actually be able to adopt and scale and be ready for bringing that pilot home and enabling the change that's needed in our organizations. And I think that in many of the, at least the pharma companies that I end up working with, I feel like that tends to be one of the biggest barriers. We need to start reading the book, What to Expect When You're Expecting a Pilot to Finish, and be ready for that change.
That's great. Excellent insights. And it's nice to hear you guys kind of boil it down to, the engagement, the culture, the change management, the executive champion, all that stuff is critical and change fatigue, all that stuff is real. And when you're doing innovation, it is, all that more important and still just as important. It's not just a new initiative. Kind of final closing questions. What are your predictions for healthcare over the next 2 years? And what are the barriers? And maybe give us 1 or 2 strategies to overcome those barriers.
I'll let you can predict the future first.
What's great about these questions is we could either deny it in 5 years, and you'll hopefully have no video evidence that we said it, or if we get it right, we'll be out there
Everywhere.
waving the flag saying, "I told you guys." So I think since this is a conference that really focuses very much on healthcare and healthcare delivery, and I come from a medicine development and research perspective, I think part of the future I'm going to lean in on here is this convergence around research in healthcare and how technology is enabling that convergence. Because in today's world, you have a patient having an encounter with a provider, and if somebody should happen to decide this is an opportunity for this individual to participate in a clinical trial, everything stops. The patient has to become a participant. The physician has to become an investigator. Their EHR gets thrown out and somebody brings in a clunky 1980s electronic data capture system. You have to sign all different paperwork and restart everything. And what we're seeing are these opportunities for increasing convergence between research and healthcare. And in doing so, how can we create more opportunities for access for both patients and physicians by removing the barriers and the burden, by leveraging more existing systems, existing data, and taking advantage of the large integrated delivery networks that are proliferating across this country and elsewhere. Because today our mindset on the research side is we think about an investigator. And we have databases of investigators as if these physicians are all Marcus Welby and hanging a shingle outside of their practice. And that's not the way any of our providers practice today. And so I think there's this great shift, and I think technology is creating a great enabler for this integration of research and healthcare, which will continue to center around delivery networks, but how we can then leverage telemedicine, visiting nurses, and all the other great tools that healthcare is implementing at scale inside of those networks and be able to leverage them in the research setting.
So what I see day in and day out, every day, in my particular role at this point is I'm very bullish about our space. We've got, so we're a large incumbent in this space. And what I see every day is the continued proliferation of not only investment, but ideas, new ways of putting together the pieces and the parts, telehealth, digital health, evolution of traditional care delivery models. I see new innovation every single day coming from outside the four walls of our enterprise, which pushes our enterprise. And I think the pace of that in the last 5 years, if it's not exponential, it's close. And so I'm very excited about that. I'm very bullish about the opportunity to solve some of the big challenges that we're facing as a system. And I'm very excited to be able to be part of, partner with, work with, and hopefully scale some of these great ideas that are popping up repeatedly every day. So I think that's the future. I think we're going to see an acceleration of not only digital and telehealth solutions, but just technology enablement of healthcare. And I think it's going to push big incumbents like us you talked about reimbursement, to be even more aggressive on that front, to be even more aggressive on some of the things that traditionally kind of stand in the way of the two people in a garage, their idea getting going. So I'm very bullish about the future. I believe in technology to get us there.
Excellent. Well, yes, if it isn't exponential, it's really close.
It's pretty close.
It is amazing how much has been growing and scaling lately. Well, I just want to thank you guys' time. This was a pleasure. I hope the audience enjoyed it. We are going to, we'll do 2 minutes questions. Anybody have any questions? All right, we're going to keep rolling and try and get back on track. Thank you guys so much.
You.
This was awesome. Really a pleasure to meet you both.
The 2019 Converge2Accelerate conference is brought to you by IEEE, the world's largest technical professional organization for the advancement of technology. Boehringer Ingelheim, passionately working to improve healthcare. NASCO, advancing digital health together. IPSI US, the Association of Independent Workers, for one, for all. Partners in Digital Health, publishers of the forward-reaching blockchain in Healthcare Today and Telehealth and Medicine Today. Special consideration to iWorker Innovations, taking the independent workforce to new heights. Connected Health Conference, designing for healthy habits and better outcomes. Haven Health Solutions, providing true blockchain transactional interoperability. Special thanks to Seaport World Trade Center for hosting us. We'll be right back after these messages. Don't go away.